Welcome back to ASDA's Ethical Issues in Dentistry mini-series. My name is Clarissa Burquez. I serve as ASDA's Ethics Chair at Western University. Today I'm interviewing Dr. Lavasani. She is a board-certified dental radiologist and our first woman interviewee. Dr. Lavasani, thank you so much for being with us today. We have a few questions. First and foremost, can you tell us a little bit about yourself and why you chose to become a dentist?
It's an interesting question because many of my family members are dentists. My sister is an endodontist, my cousins are dentists, and my aunts are dentists. So, kind of was a no-brainer to tell you the truth. So on.
And why did you choose oral radiology specifically?
So, people say like I chose that specialty or that specialty, but I think radiology chose me in a nutshell because I knew that I wanted to do specialty, but I didn't know exactly I wanted to do radiology. So I was in San Antonio to visit my uncle one year, and he introduced me to his mentor. So we were talking, and he was finishing up his fellowship. So we talked, and she was like, "Oh, so you finished dental school? What are your plans?" I was like, "I want to become a specialist, but I don't have plans so far. I don't know what exactly." So she introduced me to one of her students that they were doing research, and he was in the radiology residency in San Antonio Dental School. So long story short, and they say rest is history. So I went to the department and met with the director, and then I did a short preceptorship time, and then I got into dentistry.
And you love it?
Yes. Oh, I don't see myself doing anything else.
That's wonderful. Okay, so on to the ethics questions.
Yes.
Can you tell us about an ethical issue you've either witnessed or experienced in the dental field?
Okay, so I'm really happy to be doing the ethics interview with you guys, because most of the times when we talk about ethics, it's mostly like the main part of it is you would do what you would do to your family or that kind of thing. But really, in my experience, ethics has a broader perspective and aspect. And I think if you want to talk about diagnostics and radiology, it would be two main categories. And first one is to know what imaging modality to use for your patients, because when they come to us, like as we go to our doctors, we expect our doctors to know the newest and the best and most advanced things that are basically appropriate for our diagnostic purposes. So I really do think sometimes practitioners need to keep up with the knowledge, with the current knowledge, so they may have a good ethical background regarding that patient. But if you don't use the proper imaging modality, you would, let's say I am now a case that's really close to my heart, because I'm actually one of the expert consultants on a lawsuit. The doctor put an implant and they didn't use CBCT, so they went on panoramic images. He had a good intent, so ethically, let's say he was right, but if you don't have the knowledge, that kind of falls under the ethics of not knowing how to treat your patient. So that's one of those. And the other thing is, again, which has to do with skills of dentistry that you have to keep up with, is to know how to interpret your images. Now we have 3D images and people are buying those machines, but so many times really practitioners are not so well-rounded to know what's in the images, and they can miss things so fast. I go to, I give a lot of CEs. So when I go there and I ask people, so what do you think a malignant or a benign lesion would look like? And I get silent. So that's a big deal, Imagine if you have stomach pain, you go to your medical doctor, you get a medical CT, and imagine if they only look at your stomach. They're like, no, we just took it for endo or implant, so we just look at that area. The reality is that you are responsible for the whole volume of whatever imaging that you take. And imagine that person had pancreatic cancer. Is that acceptable to only look at the stomach? No. So I do think that it's a broad perspective of knowledge, skills, and ethics. They go together. So
that was beautifully said. Do you have any advice for your WesternU students as they graduate and go out into the world?
Yes, sure. Regarding ethics, of course. So really continuation of the skills and knowledge is that try to connect with the people that are a little bit more advanced or a little bit more ahead of you in the any field of specialty, so that you always have access to the newest knowledge. Of course, you have the internet, but the experience that they can bring to your practice is really an asset that really nobody can give you. So it's called kind of intangible asset. When you have, by the time you graduate, I really recommend that you have what they say BFFs. If you a specialist BFFs, so that you have their text message, you can call them, you can ask for their opinion as soon as you can. So I really think that access to specialty ideas and experiences is really important. Even if not specialists, people who are a little bit more advanced in their clinical skills and they've been there. And I think our students are positioned perfectly because we are so close to many good study clubs, CDA Anaheim, different things. So just volunteer your time, become a member. If membership is expensive, volunteer to do something for that study club. Then you can start to know people for your job opportunities, for you to be in the know, because many of the movers and shakers of dentistry, they are included and they are there, and you can have access to them, and you can kind of further your knowledge and ask questions. So I think that's important.
Dr. Lavasani, thank you once again for being here with us today. Stay tuned for the next episode.